This week on Mississippi Insight, some big developments at the state capitol on a lot of key issues, including Medicaid expansion and changes to the public retirement system. 12 News senior political correspondent Richard Lake will join us and preview a critical week ahead. Also, Jackson has a new deal with an old name in garbage collection. The council finally says yes to a long-term contract with Richard's Disposal. We'll recap the deal making and the fierce debate with the mayor this morning on Mississippi Insight. I'm Byron Brown. Thank you for joining us for the March 23rd edition of Mississippi Insight. The State House of Representatives made the opening moves in the push to expand Medicaid. Now it's the Senate's turn, and they appear poised to put their own stamp on a substantially different bid to broaden Medicaid coverage in Mississippi. As someone who has been monitoring the debate closely throughout the session is 12 News' Richard Lake, our senior political correspondent. He joins us now. Richard, thank you for joining us.
Thank you for having me.
Remind us briefly where we are at the start of the week and where we are headed in the coming week.
Yeah, absolutely. We'll start in last week, where last week the Senate faced a deadline to get their own Medicaid expansion plan out of the Senate. What Senator Kevin Blackwell, the Medicaid committee chairman, decided to do there was let their bill die on the calendar and pretty much take in the House bill that the House passed earlier in the session and modify it to their liking. He's shared little details on what that's going to look like. He said it's going to be a more conservative plan. Some people have dubbed it as Medicaid light. So we're still fuzzy on the details, but moving forward, in conversations I've had with Senator Blackwell, he's made it clear that we could see some action on expansion on the Senate side mid-late next week, possibly.
And why did they go that route as opposed to just coming up with their own plan?
Sure. So Senator Blackwell has said publicly to us, he sees the House expansion plan as pretty much just normal expansion, and a lot of that due to that second section of expansion, of the House version of expansion. The House version says, there's going to be a work requirement, that 20-hour weekly work requirement, but if CMS, the federal oversight of expansion plans, if they don't approve that work requirement, Section 2 says traditional Obamacare expansion will kick in. Senator Blackwell has been opposed to that, and he's communicated that he wants a more conservative approach to expansion for Mississippi.
This has been the farthest that we've got on Medicaid expansion at the Capitol in many years. Does it look like we're going to actually get something done at the end of the day? I
think so. The conversations are happening, and we've heard from advocates throughout the entire session that for expansion advocates, that's a huge win for them right now, that the conversations are happening. Last year, political non-starter to even, I would argue, to even get to this point of where we're at right now. So a deal, I think, will be met. I think both chambers are aware of the need right now and are willing to not stick their necks out there, but they're willing to show that there's a combined force to get something done.
There have been clergy and doctors at the Capitol in support of expansion. Talk about that and what impact that may have on legislators.
Yeah, that was this week. In back-to-back days, we heard from clergy and then the State Medical Association. Both of them really hammering the Senate. The House passed their bill, and the Senate, since the House has passed their expansion bill, hasn't held one committee meeting on that House bill. So the House has really pushed the envelope on this and been the real chamber of action all session. The main call for the Senate is to act, to do something, to meet in the middle, to have the discussion and to get something across. So the clergy really hit on the moral imperative of expansion and caring for those less fortunate, and appealed directly to Lieutenant Governor Hosemann as well as Chairman Blackwell and the entire Senate chamber to really try to get something across. And the State Medical Association, Dr. Edney saying, quite frankly, I need money for public health. Help me. Let's get something done. He said he's confident that something might get through and that a plan will get through.
They've been hammering on this insurance gap that we've been talking about. How much is that resonating there at the Capitol?
I think it is. I think a lot of advocacy groups have pushed to the front lines people who have been within those coverage gaps, having them explain, here's what my day-to-day is like, already being low income, maybe having a family, and then on top of that, having to think about that healthcare issues and that lack of coverage. It becomes a very human issue, as is healthcare all the time. So I I think lawmakers are, of course, aware of it at the end of the day, that they represent some of these people, and they're hearing these stories. And I think, again, the conversations are happening, which is farther than we've been in years past.
Yeah, Insurance Commissioner Mike Cheney, he got into the debate last week, said he supports Medicaid expansion, but only for those making 100% or less of the federal poverty limit. The House plan calls for those making up to 138% of the limit to be covered. So isn't the number of working Mississippians to be covered at the heart of this debate here when it comes to Medicaid expansion?
I would say it is. I think the majority of the legislature at this point in time has kind of ditched the we don't want a federal government handout at this point in time, and it's more, okay, if we're going to do this, let's make sure that this is the best thing possible for Mississippi taxpayers. And I think Commissioner Cheney, his hesitancy to push to that 138% federal poverty level number, which is important to note, pretty much every expansion plan is the 130% is standard. That's what you're going to get. His fear is that when you include the 100 to 138%, is that it's going to harm the private exchange and the private market of health insurance right now. And he doesn't want people leaving that private market to go for a government program. The flip side of that argument is that people on the private exchange right now are paying higher out-of-pocket costs. So again, I think that's where the Senate will be taking that more conservative approach to say, hey, let's help out the private market a little bit while also trying to tend to the people that are struggling in the state right now. And I think there's some disagreements on this number, but roughly 145,000 individuals in between the 100 and 138% of the federal poverty level. And adding on that many people to the rolls is still a major concern to a lot of big players in the Senate, I would argue.
If you were to have a guess at here, I mean, they're looking at maybe 200,000. They were saying maybe 280,000. What are you looking at? Maybe 150,000 that might get insured if they have a plan here? The
numbers is at least 200,000 is what we've been communicated, and I know what we've reported. We don't know yet, though. 2024 CMS numbers aren't available yet. So we're unsure, and that is still a huge sticking point. Again, for a lot of major players in the Senate.
Governor Tate Reeves has been adamantly opposed to Medicaid expansion of any form. He said that multiple times, but lately, since the Senate and the House have been debating this, he's been quiet on this. Has he said anything lately since the House passed its plan?
Yeah, he's been very active on social media. The day that the House passed their plan, he named House Medicaid Chairwoman Missy McGee by name on social media, and the bill by name on social media, saying that it's bad for Mississippi and bad for the state. He's gone as far to say that he still believes Obamacare, Medicaid expansion, as he dubs it, is bad for the country and is bad for the state of Mississippi. And his opposition is absolutely getting included in the calculus of all this, in the sense that while a chamber, be it the House or Senate, may have the votes to pass this measure, they have to account for that 2/3 majority to override a veto in both chambers. So it's absolutely still present, and we've seen from other reports saying that he's told senators privately he will veto any expansion bill that comes to his desk. So it is present in front of mind for leaders right now to not only have the votes in your chamber, you have to have that majority right now.
Has the governor said what his plan would be to deal with that insurance gap?
To my recollection, no. I know that he's been heavily communicating the fact of better employment options yield better health care outcomes, yield better insurance, things like that. But still, as we see the state lagging in the workforce participation rates and things like that, I know there's still conflicting statistics around that. But I think his method, what I would assume, would be focus on the economic opportunities that you can afford people.
What should we expect in the week ahead? Like, Medicaid has been dominating pretty much the session. What are we expecting in the week ahead, and as we get into the last week of the last month of the session? I should say.
Busy. It's going to be a lot of action. Lawmakers face an April 2nd deadline to get whatever legislation out of committee. They face that on April 2nd, and then on April 10th they face a floor deadline to pass whatever legislation on the floor. So as far as Medicaid goes, anything needs to happen before April 2nd. Again, conversations I've had with Senator Blackwell, he's indicated to me that we could see something move, whether it be a committee meeting late mid next week is that we might see some movement. I know that there are some communications moving around regarding the Democrats and their plan to maybe get their messaging out on what they believe the Senate plan to be. But next week should be very busy, and we should get a much clearer picture on what everything looks like.
All right, we're getting wind down at the end of the session here, so one more month to go, basically, almost.
Last full month is
and
April.
we'll see what turns out.
Absolutely.
Busy time.
Busy time.
Richard, thank you.
Thank you.
Okay, and we'll be right back. We heard a lot from stakeholders in the public employees retirement system last week. This as senators considered moves by the House to restructure the system. They heard Wednesday from PERS current board of trustees about their reservations about the changes and the financial stability of the system. And we got a chance to hear from several leaders involved in the debate, including Senator Chris Johnson, Hattiesburg Mayor Toby Barker, and PERS board chairwoman Kimberly Hanna.
This is really just a numbers issue, and regardless of who is on that board, the numbers are still going to be the numbers.
So during the meeting, several legislators asked if y'all would be open to the idea of additional board members. In the House Bill 1590, the board would be replaced by state-appointed officials. It sounds like they might be trying to compromise in some fashion. Would y'all be open to state-appointed board members either joining you?
We do have some concern over the, diluting of the representation of the 330,000 PERS members, whether they're retired or active. So that is a concern. We would need to discuss that with some of the staff, what that would mean. I'm open to advice. I don't pretend to know everything, so I certainly am open to that. At what number and what level, that is a bit concerning for the current members and the current retirees.
Your colleague, Mr. McCoy, said that the sky's not falling when it comes to PERS. Do you agree with that assessment?
Oh, absolutely, I agree with that. You've got to consider we've got a funding policy, and there are certain triggers on that policy where we increase the contribution rate, which is the only tool that we have in the toolbox. And that it called for it. It called on it based on a 7.55, not even a 7 that we reduced the assumption to, but it was based on the 7.55 that the contribution rate needed to go up. So the assumption of 7.55, the contribution rate going up, that was all in our funding policy, and it was a trigger. We look at this long term. We don't want to wait until the sky's falling. So that's what we're doing. We're raising the red flags now. We're asking for the increase so that paying now doesn't end up costing us in the long run.
Well, getting a better understanding of what role the board plays and what levers are available to them. One of the issues that we have at the state level is facing additional appropriations that were not planned. And so we want to, of course, be cautious with expanding appropriations through the employer contribution, but then we also want to make sure that we make the retirement system as sound as possible. And so learning what they had to say. See, I'm terrible at this.
No, that was perfect.
But learning more about what levers are available to them and how we may be able to assist was very important, I think.
One of the main things that at least Mr. McCoy wanted to get across was that the sky is not falling on PERS. Do you agree with that assessment, and how critical do you think that is?
I agree completely, and I think it's huge. Over the last 6 days, I've been contacted by many, many people throughout Mississippi, and there's true fear with many of them, and I don't think it's warranted. I think that the retirement system is sound as it is. We're just looking at what could happen in the future and how to prepare for it. And so retirement benefits are in place, they're sound, we're going to make those benefits and honor our commitments. And I think that that's important for people to know so that they're not afraid of losing their benefits.
I do just want to ask you, what kind of changes are you looking to make to House Bill 1590, if any, before you get it to the committee?
I'm really not prepared to say anything right now. Today was really information gathering, and I have no idea. We need to get back together. We need to talk through what we've we learned today and try to find out ways that we can assist and help the PERS system in the least intrusive way on taxpayers.
Right.
So first priority is making sure that the system is sound, which we heard today that it is. Next priority is protecting taxpayer dollars the best we can from hopefully unnecessary increases.
Right.
It's no secret that the unfunded liability in PERS is a problem, and it's a storm that's been brewing for some time. We began voicing concern when the PERS board approved an increase in the employer contribution, which is the amount that every state agency, city, county, and school district kicks in for each of its full-time employees, from 17.4 to 22.4 in December 2022, only to rescind that in spring 2023 when cities and counties went into an uproar and the legislature threatened to take action. Then the PERS board approved that same increase late last summer, but phased in, thankfully. And those phased-in increases will be 17.4 to 19.4 in July of this year, 19.4 to 21.4 in July 2025, and 21.4 to 22.4 in July 2026. And many are reporting that going from 17.4 to 22.4 is simply a 5% increase in that contribution for employers, but not so fast. Increasing the employer share 5 points actually equates to a 28% increase in retirement costs for cities, counties, state agencies, and school districts. But there's more, because the PERS board also voted in that same August 2023 meeting to lower the assumed rate of return to 7%. And while I certainly understand the more conservative approach in the outlook, the PERS executive director told the board that they should be prepared to continue raising the employer contribution to potentially 27.4% over the next 5 to 7 years. 27.4%. For Hattiesburg, 27.4% means that we'll have to come up with close to $3 million more annually to cover retirement contributions for our existing employees. And my encouragement to you, to the committee, to any member of the legislature is before you simply go forward with the tried and true method of simply saying no when a lawmaker is bold enough to propose a PERS policy change is this. My encouragement first is to please call your mayor, your county supervisor, or your school superintendent and ask them how much it will cost if and when they're having to pay 27.4% employer share on each full-time employee. Then ask your mayor, county supervisor, or school superintendent as to where they plan on finding that money. Raising property taxes? Yes, and probably multiple times. Cutting services and employees? Absolutely. Which, by the way, makes the PERS problem even worse because you have fewer public employees paid into the system. Raises for city and state employees, including first responders, at the local level, that's doubtful at best. The truth is, though, that even the bill before you, House Bill 1590, as it stands, won't provide the permanent solution, and we as a municipal league are not saying that it will. However, as a municipal league, we support that part of it that would rescind the initial increase in employer contribution from 17.4 to 19.4, preventing a tax increase in some of your towns, counties, and school districts. And I've seen the alerts being shared on social media, particularly the line that says, and I quote, 2% of that much-needed employer increase was scheduled for this year, and House Bill 1590 blocks that increase in PERS funding. The translation is, the House listened to local elected officials who didn't want to raise local taxes on their citizens in order to put yet another temporary patch on a growing problem and unsustainable approach of solely leaning on employers to cover the unfunded liability or hoping that a fifth tier helps us in 25 to 30 years.
Monitor 12 News in the coming week for updates on the PERS debate and other legislative affairs. We're back in a moment. A breakthrough vote by Jackson City Council followed yet another bitter exchange of words about Richards' disposal. Council members voted 4-3 in favor of a 6-year garbage contract with Richards. But more negotiations are required after the council struck carts out of the contract. 12 News' Cameron Smith has more.
This new change to the contract will save the city $40,000 a month. That's about $2.9 million over the term of the contract after cutting out the 45,000 carts. But it was a little back and forth to get to that understanding.
For the last 2.5 years, I think we have been out-negotiated, out-lawyered, and out-maneuvered by the Richards team. And the result is we end up with something that's very, very expensive, and we don't even get the money back on the carts we save.
Foote says this may be what the city has, but not the best deal.
I don't think it really represents being good stewards of the taxpayers and the garbage customers' monies.
The mayor says what some of his council colleagues failed to appreciate is that there were some sunken costs that couldn't be removed.
One, the rear loaders that the cans were to attach to that empties the can out. Those are already purchased, those are already on the trucks. So Mr. Richards can't get that back, right? That's something that they didn't know was a part of that $96 fee that was applied for the cans.
Foote and Hartley have always voted against Richards' disposal from day one, saying the process was flawed.
I'm hoping that that somewhere along the line that we can recover and we're not severely damaged by the entire process. But folks will have the garbage picked up.
Meantime, while the city's price is increasing, Councilman Foote tells me customers will continue paying the same rate of $35, at least for now.
Big thanks to Richard Lake for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown from all of us here at 12 News. Make it a great weekend.